Hola a todos. En breve, en un minuto más,
Hello,
estamos
everyone.
con este seminario virtual
We
sobre
will
lessons
begin our seminar on lessons learned in communication on risk and community participation. We'll be starting in 1 minute. Thank you all for connecting.
Se va el sonido.
Ahora sí, perdón. ¿Qué tal? Muy buenos días, buenas tardes, buenas noches a todos.
Again, hello, everyone. Good morning, good afternoon, good evening, depending on where you are. Welcome to this virtual seminar on lessons learned in communicating risk and community participation. This is a seminar organized by PAHO, and this is the second of a series of seminars. We are going to hear from representatives in the region about good experiences and share lessons. The idea is to share experiences that can enrich our response in risk communication. We'll look at strategies used, what worked, what did not, and that way we can learn from each other. As we know, with this new virus, with this pandemic, we are all learning as we go. I am Sebastian Olier. I'm from the Communications Department of PAHO, and I'm not here alone. My colleagues Pablo Lidia, Maritza Navania, and other colleagues from PAHO are with me today, in addition to our guest panelists from Chile, Cuba, and Honduras. Now, some technical announcements for you to take into account. We do have simultaneous interpretation into English. And to hear the interpretation, you can click on the interpretation icon at the bottom of your screen. Also, you can submit questions to the panelists, send them in through the Q&A. Also, at the bottom of your Zoom screen, you can see where it says Q&A. After the presentations, we will have time for a Q&A. So please do send in your questions as you listen to the presentations. Now, with no further preamble, we are going to hear from Silvan Alighieri, who is leading the COVID-19 efforts here at headquarters. He is in charge of coordinating the technical response to the pandemic. So Silvan, please go ahead. Thank you, and hello, everyone. I am Silvan Alighieri, and I am the coordinator of PAHO's COVID-19 response. Because due to previous commitments, I'm not able to connect live today. We have decided with the communication team in Washington, D.C. to record this short message. First, on behalf of PAHO, I would like to welcome the colleagues who are with us for this virtual seminar on risk communication. I want to thank the representatives of the Ministries of Health and my colleagues from the PAHO country offices for being with us. They're going to be sharing with us some of the strategies for risk communication and the way that this helps cope with the COVID pandemic. Also, we're going to be hearing from our colleagues from Cuba, Chile, and Honduras, amongst others. Now, For some 17 months now, we have been dealing with a public health emergency of international interest. And that situation is still quite concerning in several areas of the Americas. That would be in Central America, South America, the Caribbean. It's important to point out that it is the Americas that have borne the greatest brunt of this pandemic worldwide. On the 16th of June of this year, the Americas contributed to global figures with 40% of the cases and 48% of the deaths. One of the major challenges that we have faced, and here I'm speaking on behalf of the institutions responding to the pandemic, one of our major challenges has been how to deal with the community. And here we're going to be hearing some innovative experiences, and I hope that all of this will be helpful to develop strategies in other countries or in other subregions. We have learned how to connect to the public in different ways, sometimes using new digital platforms so as to provide education on health and also to increase the reach of our messages so as to provide suitable information to adequately inform our communication while maintaining social distancing and following public health measures. Now, this pandemic reminds us that there are different approaches to a disease, and diseases have to be dealt with in different social contexts. And that means that we have to have a more comprehensive, more collaborative response at the local, at the regional, at the national and global levels. We hope that the initiatives described in this seminar will contribute to that overarching objective. And after my short remarks, I send you warm greetings on behalf of the whole response team here at PAHO. Thank you.
Gracias, Silvan, por sus palabras.
Thank you very much, Silvan, for your remarks. You're reminding us how important it is to continue to communicate and work with the community in our region. You said we have 40% of the global cases and 48% of the lives lost. So there is still a pandemic and we have to see how to cope with it. Now we're going to hear a presentation entitled Experience with Risk Communication in Chile with the Health Brigades. This is a presentation that will be made by Dr. Paula Daza, and Fernando Leanes, a representative of Chile, will also be addressing us. So Leanes, Fernando, please go ahead. Thank you, Sebastian, and a happy birthday. A warm greeting to all of you. A special hello to all of my colleagues, especially from the Ministry of Health in Cuba and Honduras. I greet our panelists, and it's a true pleasure to tell you that Chile has been working, and here I speak on behalf of the PAHO office in Chile. So we're working in different ways. We're doing wonderful work on testing, isolation of cases, testing. We are putting together a system called Step by Step to establish public health measures that are evidence-based. All of this while we launch our vaccination campaign. But right now, the Southern Hemisphere is in a situation of risk, and the challenge being faced by Chile and other countries too is that people have to abide by the public health measures that can be taken to prevent what is called community transmission, and also transmission of people that have COVID symptoms without isolating themselves and with no contact tracing. So I think that here, on behalf of Chile, we're going to hear from Dr. Daza telling us about their experience, and then we will be telling you what PAHO is doing. Our efforts may be more focused, but I was able to work with Dr. Daza. We were there for the launching of the system of health brigades. And I think that the major challenge faced by Chile today is communicating the risk to get everyone to change their behaviors and thus increase prevention. So once again, I wanted to thank PAHO DC for their support. I see that we have with us colleagues from Honduras and Cuba. So with that, I just thank you for this opportunity. Thank you very much. Yes, we know it's not easy to change behaviors, and people are getting tired of the pandemic, especially because it has been so long lasting. So now we're going to hear about Chile's experience with the health brigades. Hello, Dr. Daza. Thank you. Good morning. Well, good morning to you, Sebastian, Maritza, all of the team. It's an honor to be here for this meeting with other experts from Cuba, from Honduras, so a special greeting to them. Also, greetings to everyone that is part of this meeting on the communications world. So it has been a pleasure to work with PAHO always. So first of all, thank you for your invitation. And I begin by sharing a video with you that summarizes the strategy. And I will be making a short presentation to show you what we have been doing here in Chile. Can I share the video with you? My name is Denise Vergara. This is me, Denise. In September 2020, we began to visit regions of Chile in response to the pandemic. And the idea was to enable communication of risk, education, and health promotion. Now, what was our purpose? The idea was to establish a conversation with people. And we were there to listen to people, hear their doubts about the pandemic. Our interventions are not lineal. We tried to clear up any confusion or any doubts about COVID-19. The health brigades began to cover all the regions of the country, from Arica to Magallanes. We have 390 members of the brigades. We work with cultural diversity, and we try to make certain that people hear our message directly. We have intercultural health brigades, and we share advice. We teach self-care and how to prevent COVID-19. During all this time, we have talked to all the young people, the elderly, children, parents, teaching them how to take care of themselves by using face masks and washing their hands. Also, we have visited businesses. We go to bus stops, to beaches, and also in public areas that are especially visited. So it is important that we distribute this information using different platforms. In this way, we have reached more than 2.5 million people, which represents more than 14% of Chile's population, educating, talking, but especially listening about their doubts regarding COVID-19. As part of this strategy, we have different programs, and we share information on the epidemiological status in the country. We also have worked with both Chileans and foreigners that arrive in Chile. Now, we have created CESFAM. Those are the care centers and areas where we are deploying vaccination. So we are increasing our early messaging teaching self-care. We are getting out the message of self-care, testing, isolation. We know that we all need to receive these messages so as to deal with the pandemic. So we created two programs where civil society has joined our strategy to deliver our messages and clear up any myths or doubts. The idea is to create trust, especially now that Chile is about to begin its school year. And there we go to schools. And who makes up these groups? Professors, students, parents, and others who have been trained specially so as to get out the message, to deliver information. We're in all regions with more than 1,600 health brigades across the country. The other program began a month ago, and those are the neighborhood health brigades. They are trained and they are the ones that supply proper information. We are always there to support them in their interventions so they can get out a direct information that comes from other community members. The idea is to work together to control risks and diseases. So we are the health brigades.
Bueno, quise compartir con este video que resume un poco las
I wanted
estrategias.
to share this video with you. It summarizes our efforts to a certain extent. Also, I wanted to share a PowerPoint presentation with you so you can see what the strategy is like. First of all, this is the way we have been dealing with the pandemic in the country. So we think it is important to have taken these measures. Fernando talked about a plan called Step by Step, and it has to do with lockdown, with following different epidemiological parameters to control the pandemic. The second point that is very important in terms of the pandemic is a strategy that we call testing, traceability, and isolation or quarantine. Now, the idea is to test, and test, to trace cases and keep those people isolated so as to break the contagion. Now, also, number three is vaccination. And there we also record hospitalization and deaths. And then number four is communication on risk, promoting protective factors, as well as behaviors that are preventive in nature to reduce contagion. And today I'm going to refer to these four different points so as to share with you the way that we have created these health brigades. Now, here, how, and I think you saw this in the video, but how are we communicating risk? That is always going to be a major challenge. Sebastian said that it's hard to tackle it successfully. It's not easy. And it's especially hard now with the pandemic, right? Especially after 1 year and 3 months, where people have begun to experience what we call pandemic fatigue. Now we have a greater degree of certainty, but nonetheless, there are a lot of doubts, fears. So you have to know how to adapt. You need to realize there are different audiences so as to recognize, even on the ground, when you should deliver a given message to a given population. As you know, we have great diversity in our country. It's a large country, and there are many different cultures. Now, in Chile, the development of the strategy and this idea of the health brigades was synchronic, as has occurred in other countries of Latin America. In some regions, in the South, for example, there were efforts that spread to other regions, and consequently, we have had to adapt the message according to the circumstances, the epidemiological status, as well as the cultural differences of the different groups in the region. So this requires specific messaging. For example, to a certain extent, you have to take into account the worldview of some populations in the southern region of the country, and that affects some of the most vulnerable communities, especially people who are migrants. You also have to take into account age and gender. So one thing is dealing with an older person, or men and women may have different considerations that are important to them. So that means that we have to find a way to approach these people. We realize that the press plays a vital role in communication, but we have to find a more individual way of messaging to share a dialogue with the population. So the idea behind the health brigades emerged some months ago. These brigades basically were created in September of 2020 as a strategy, and this was a response at a difficult juncture where in the country there was a great distrust of authorities, different organizations. So we needed to create a climate of trust and eliminate uncertainties. That is something that you saw in the video. The idea was to have people deal with trusted peers so as to learn from them. Now, they provide complementarity to the message being sent by the authorities regarding our fight against COVID-19. Now, the way that the work is done is stressing the importance of our citizens. So not only is it important to deliver a message, it is important to listen to the community. And that is an important role of the health brigades. They work with the civil society, and civil society is responsible for furthering this dialogue and also for persuasive efforts. So we know that here the benefit is not only individual, it is shared. And the idea is to promote health and reduce risky behavior, especially now after a year and 3 months. Another objective is to promote vaccination and communicate information better and in a more customized, individualized way. The idea is to have a closer dialogue that is in keeping with the different groups we target. Now, the objectives of the health brigades. What are the specific goals of community facilitators? Their objective is to create an awareness in the community and provide information on self-care measures so as to increase the knowledge of the people. So that will lead to a change in behavior. And that is something very hard to do. It is hard to get people to change their behavior, especially now, 1 year and 3 months into the pandemic. The overall objectives of the community facilitators, and you saw this in the video, is to deliver information on self-care measures for different age groups, the use of a face covering, physical distancing, hand washing, also uh, providing good ventilation, especially now in the colder months. And this is different from the Northern Hemisphere where you are in the summer months. Also, we have what we call a health residence. That is where people can be put into isolation if they are sick. Also, it's important to deliver these short messages about self-care, hand washing, but they have to continuously insist on the correct usage of PPE. So there, the brigades have played a vital role. Now, the implementation of the health brigades aims at transforming the decisions made in the community and to promote collaboration. This is a major challenge. How can we change behavior? How can we encourage preventive behavior? So it also, we had to train the facilitators. The facilitators are basically employees of the CEREMES, and the CEREMES are regional health authorities. Chile has 16 regions. In each region, there is a health authority. They follow a defined profile and they do health promotion and also encourage citizen participation. Now, here, an important role is played by young people, people that work in the education sector, and also in the social media. Also, we have the people from civil society. They are trained by the CEREMES, by the national, regional health authorities, and the people from civil society have a direct relationship with the facilitators that belong to the CEREMES. So this is very important because they play a motivational role. Also, they support the voluntary facilitators. Now, how has the implementation gone? How have we implemented the process of the health brigades? You can see this here on the screen. So there are different processes to make these brigades operational. First of all, this begins in the Ministry of Health. Then that goes to the CEREMES, the facilitators in the community. And there is a direct linkage with the facilitators from the Ministry of Health. And that direct communication provides feedback to health authorities.
Information always comes from the Ministry of Health to both the ministry officials as well as volunteers. So that has been really enriching. Uh, the regional organizations receive training from the Ministry of Health, and then the facilitators do their job in the communities themselves. And from the communities, they spread out to the different households, and all the messages are aligned in order to achieve this change of behavior that we need so much in order to communicate risk. The eighth point that is very important in terms of how these health brigades work is that health brigades have volunteer facilitators. They are social leaders. That's what we call them. They do their work in their own environment, be it at work or in schools or in the neighborhoods through radio messages, social media. But the facilitators and officials are deployed based on needs. And the health authority is the one that decides the type of material to be delivered. And as you know, there's different infographics or audiovisual material that is shared between the two types of facilitators. And this is the same type of materials that is used in all media outlets. So this comes from the central level, it goes down at the Ministry of Health level, and then the same message is delivered to each one of the communities in a very consistent way. Facilitators have support materials, which is the same materials that authorities have. So everything is harmonized to send the same kind of message in terms of how things are evolving and how the pandemic is looking. Now, in terms of how these health brigades,
voluntarios de la sociedad civil
it's very important to know how they work because civil society organizers have a lot
en
on
todo
the
momento este diseño que
secretariats so that they
iniciativas distintas
deploy this consistently at the local level. And also we gather the best
territorial
so we can share
comunidad,
at
con la familia.
level or at the household level. And authorities also reinforce these types of behavior on an ongoing way through the messages that we display on different media outlets, as well as with the information that we share with other authorities. So the same message is conveyed consistently to the community through facilitators or our Ministry of Health authorities so that we can deliver the same message consistently. Now, in terms of training, it takes place on an ongoing basis, and we also have refresher training. This training is joined by different divisions, which is the way we call them. So according to the area that we want to strengthen and the expertise that's needed, we decide who will attend and what kind of message to reinforce. For example, the epidemiological environment, what lockdown means, how the national immunization plan is going, and we work on this through our officials. We also emphasize vaccination strategies, why it's so important to vaccinate certain sectors of the population, what risks vaccination entails, etc. So we tailor this according to the epidemiological situation and the message we want to deliver based on the different protocols. And obviously, we use PPE, which is something that we reiterate on an ongoing basis. Another item that I think is very important to highlight is to deliver the same message. I mean, it can be done through different channels, and we can tailor it to the region or a different, cultural background, but the same message is delivered consistently throughout the country. And this is done through our regional authorities for each one of the regions in our country, like we said. But at the same time, the information is distributed throughout the country to the different health brigades members, and they are the ones that deliver the message personally to the people. You can see how they're doing their job in different locations, and through the regional secretariats, they distribute this material to people on the street. And they also deliver the message to the different programs. We have health brigades in school, we have health brigades in the communities, and they are consistently delivering the same message to the population. The same graphic material that we show on TV is delivered physically to our neighbors that are up to on every single corner of our country, from the very northern part of our country to the very southern. So the same message is crafted and delivered throughout the country so that there's consistency in what we say, and that builds credibility. My apologies, you only have 2 minutes left. Okay, let me skip a few. And finally, we have to talk about what the future holds for these health brigade. I believe this is an invaluable program because it enables us to reach. We need to continue working on this. So in that sense, the idea is to include more health brigade members, as this is a type of work that they do individual one-to-one in the neighborhood to different groups. So it is key to strengthen these brigades. And to conclude, I would like to share what the lessons learned have been. Well, it really resonates with their citizens to hear the message on individual responsibility. Also, people that do not work in the healthcare sector must be responsible and do their share to fight the pandemic. And finally, the different territorial practices that we got from other experience in, education, communities, and workplaces is key, because this reinforces the message. So the idea is to get to the different groups in different ways, and to ultimately let everyone understand that the only way to put an end to the pandemic is by being a part of being careful about
Muchas gracias,
self-care
doctora
and vaccination. Thank
Fernanda
you.
puso
Thank
enseguida
you
ese excelente
very much.
iniciativa, la de la importancia de
The
resaltar
QAA
la
said
difusión a buen
excellent
puerto del
Health Brigade
conocimiento, apoyo,
initiative because it
sensibilización.
provides
Lourdes también
knowledge,
también
support, and
felicitaciones
awareness.
a
Lourdes
los
also
voluntariados de la sociedad civil
congratulations
aquí
civil
local
society
para las
volunteering. It has
actividades.
been key
Así que
to reach the
felicitaciones por
different
esta
communities. So
iniciativa. No sé si
congratulations on
ustedes
this
están
initiative.
mirando
And if those of you who are listening or watching have questions on this Health Brigade program by Chile, you can write on the Q&A button. Dr. Daza needs to step away from the meeting, but Noela Zunino from the Communications Department at the Ministry of Health in Chile will be available to answer any questions that you may have about these efforts. So thank you very much once again. And with that, we move on to Cuba. So our colleagues from Cuba will talk about the use of social media and Telegram to communicate with people during the pandemic. We're going to hear from Dr. Georgina Perez Alvarez, head of the Institutional Communications Department at the Public Health Ministry of Cuba, as well as Leslie Alfonso Santos, communications specialist and social media manager, also at Cuba's Ministry of Health. So thank you so much for joining us today. And without further ado, the floor is yours.
No, creo que están en silencio todavía.
Your microphones are muted, so we cannot hear you.
Vamos a ver si podemos. Sigamos intentando un minuto más.
We cannot hear you. Let's try again.
Ya.
How about now? Good. Okay, well, good morning. Let me begin by sending greetings to all the participants to this seminar. And let me begin by thanking you for giving us the possibility of being part of this event and share with you the humble experience that the Communications Department at Cuba's Ministry of Health has. We would like to begin by saying that Cuba, from the end of January 2020, developed its strategy to fight the COVID-19 pandemic, which was from the very beginning supported with a communications plan to face the COVID-19 pandemic. This plan was updated 3 times to match the different outbreaks that we had in our national territory. Could you share my presentation, please?
Vamos a colocar la presentación, ahí la estamos viendo.
Okay, we can see your presentation now. Next one, please.
Próxima.
Next one.
Creo que tenemos un inconveniente técnico.
I believe we're having some technical difficulties.
A ver, sí, pueden continuar.
Let's see. You can continue. Okay. So again, the plan was updated 3 times to match the different outbreaks we had in the national territory. As far as we know, this plan was based on 3 fundamental pillars that ensured successful communication in times of crisis. 1, the daily press conference on the epidemiological situation in the country through national TV. We appointed an official spokesperson, Dr. Francisco Duran Garcia, head of epidemiology at our ministry. The second is to use mass media to send a consistent message and to better coordinate our press messages. And the third pillar, or the third element, was to use the Public Health Ministry website as well as its social media as ways to relay official information, and Telegram was the official channel to distribute information. The daily press conferences that we held were transmitted, broadcast live. Next one, please. So as I was saying, the daily press conference was broadcast live, and this was one of the main ways to communicate on the pandemic in Cuba. From the very beginning, these press conferences were used, even though the first ones were not broadcast lives, but that we do have them. In the past, we just invited national and foreign press members because, and it was on site because the epidemiological situation was not that bad. So they could come and ask questions. And we didn't have a single spokesperson. Rather, we have several people that we invited to that press conference. It could be representatives from other organizations that happen to be joining us at the time, as well as other authorities at the Ministry of Health, for example, International Sanitary Health and different units at the Ministry of Health, so that they could give their presentation and answer questions about what to do at each time. That is to say, we needed to keep our people informed. That was at the beginning. Then, as the situation worsened, a decision was made to make these press conferences on a daily basis. And we decided to appoint a single spokesperson because of the leadership, the respect, the reputation, and the personal characteristics of that person was the epidemiological director. And he is the one that holds press conference in Cuba. This is Dr. Francisco Duran Garcia. So every day at 9 in the morning, he gives a press conference that is anywhere from 30 minutes to an hour long. And in the press conference, he provides all the information to the entire country. So that press conference is held at the Ministry of Health, but in each one of our provinces, we also have a press conference. That is to say, we have a spokesperson in each one of the provinces that relays information relevant to their territory. So the people of Cuba is informed by Dr. Duran at the national level, and then each province gives specific details in their press conferences. This is also broadcast live. This is via Telecentro and other territorial TV stations that cover the entire country.
La próxima.
Next one, please. Now, okay, I already said that, but during that press conference, we oftentimes invited our ministry to address several topics. So he appeared to these press conferences and other TV shows, but during the press conference, we had Dr. Duran and our Minister of Public Health. So this is for mass communication. Among the actions that took the longest in the communication areas, we must mention communication with the press, and we also had to keep our reputation high with the mass media. In order to do that, we had different types of sessions, workshops with the media to keep them updated on the topics we were going to deal with. We clarified workshops on a weekly basis. In coordination with our mass media, we had meetings with people that were responsible to keep the historic memory of COVID-19 in our country. In addition to that, we also provide training sessions where all journalists are invited, and we update them on the topics, and we give them the latest and greatest about the COVID-19 in our country. In addition to that, we hold exchanges with our national media outlets and international that are accredited to work in our country. During COVID-19, we couldn't do much because of the epidemiological situation, but as things got better or as alternatives were found, we found other ways of keeping our media informed, and the communications area was always there to support the media. Next one, please.
Sitio web del MINSAT. Podemos hablar que el sitio web
Public Health Ministry website. We can say that the website from the very beginning became the official source of information for the media and population in general. And that is why from the first time COVID cases were identified in Cuba, we use the website to report on that information. Today, we have 474 press releases and documents that were shared via our website. After 11 days into the pandemic, and as transmission rates increase, we started updating this information on a daily basis, such as daily number of cases, tests, positive cases by province and municipalities in the country, as well as evolution of cases that had been confirmed, whether they were mild, severe, critical, or death. So all this information was shared on a daily basis. So Dr. Duran held a press conference from 9 to 10 a.m. and at 10 a.m. the Ministry of Health would give the daily update. So he would say it and we would post it. So that would become the official source of information on the COVID-19 pandemic. So then based on this information that was useful for the population, we were able to position our website among the top in our searches. Our URL ranked 11th in Alexa. In February 2021, it ranked 8th. The official website to provide information, Worldmeter, was linked our MinSat statistics as official source of information. And so far, we have received over 4 million visits, and on average, there's 9,000 daily visits. Now, Dr. Disley will talk a little bit more about social media.
Buenos días a todos. Muchas gracias por
Good
este
morning,
espacio.
everyone, and thank you so much for this opportunity. In the case of social media, next slide, please.
Siguiente.
Next one.
En el caso de las redes sociales,
In terms of social media, from the very beginning, Cuba's Ministry of Health had a Facebook page. We also have a Twitter account, a YouTube channel. When the pandemic started, like Dr. Georgina just said, from the MinSat website, we started including daily updates in order for all information on COVID-19 that was posted would be considered official source, both for the media as well as for our population. And you could access MinSat through our social media accounts. We knew that in posting this lay.
Pueden hablar un poquito más lento
Could you
porque
speak a little bit slower, please? Your Cuban, it might be a little bit fast. Your Cuban Spanish might be a little bit too fast.
En el caso de las redes sociales,
Now, in the case of our social media, we knew that we had to be in quarantine. We stayed home, and the people started to communicate with themselves. Well, happened digitally, and our social media accounts was the main source. So from the social media, we needed to keep our population informed on what was happening at the country level, the epidemiological situation, number of cases, and also to make our population aware of how we should protect themselves from the virus. In the case of the MinSat social media accounts, ever since we started providing daily updates on the social media, it would be on the official website, it would also be posted on the Twitter and Facebook accounts, and there was a link to the website if people wanted to access more information. As we can see, we have a flow chart of what a person needed to do if they were to become sick. So once they tested positive, what did they need to do? What they needed to do to go to hospital, the different quarantine centers, and what the flow looked like. So all of this was posted on our social media accounts. All of the information, anecdotes, and everything started being posted on our social media. And so we increased our number of followers that really spiked. So much so that Facebook and Twitter had 4 times as many followers as they had before the pandemic. In the case of other social media, such as Telegram and Instagram, we saw the need to create new areas, next one, please, for communication. Social media were the way to communicate, to our people, but we knew that messenger services, WhatsApp and Telegram, were increasing in popularity as well. And that's why we decided to create a channel in Telegram that would enable us to be in contact immediately, given the popularity of our messages. So we would reach different audiences, whether we use Facebook or Telegram. So like Georgina was saying, 11 days into the pandemic in March 2020, we decided to provide 11 daily updates. So we created this channel to provide updates. And the final purpose of this channel was to provide daily updates. It was only going to be used for COVID-19 communication, but over time it evolved and included more things. As far as the content goes, well, daily updates, and these daily updates did not just link the information to the website, and that was the main difference we had with Facebook and Twitter. In the case of Telegram, we posted the entire communication with the Telegram tool so that the users from the platform itself could access to the daily update without having to leave the platform, because we know that sometimes that was a little bit cumbersome for the users. So from the platform itself, we created infograms with information, number of cases, number of tests performed during the day, and all that information could be shared. A lot of people shared that information and they expected that 10 a.m. update. As soon as the update was released, they started texting each other back and forth, and we had feedback right away because people were really waiting for that. Now, this content later on was alternated with more emotional type of content because a few weeks into the pandemic, we started having a 9 p.m. applause for our healthcare workers. And we knew that from the platform, we could use the space, and we started posting at 9 p.m. together with the national applause. Thank you messages to our healthcare workers. Next one. So these are the messages that were shared with the hashtag applause for life. And it was a way to thank the healthcare workers that were in red zones, or healthcare workers that were part of the Health Brigades, or the students that volunteered to work in daily reviews or the quarantine centers. And at the same time, this information was sent to the channel with last minute information or anything else that needed to be shared. Then in April 2020, and this is one of the big landmarks for the country, we were able to have it certified. We talked with the platform and we were able to certify the channel. And this was a big thing for us because it was the first channel in Cuba to achieve the certification. And after that, the platform increased by over 100,000 subscribers over a month, thanks to that certification. My apologies, you only have 2 more minutes. In terms of surveys to channel users, they reiterate how important it was because they didn't have to leave the platform and they could use information. That was the only source of information that they would check for COVID-19 related information. I'm sorry, the interpreters cannot hear her. I don't know what happened with the microphone.
Creo que no los estamos escuchando.
We can't hear you.
Sí.
En escucha social, una forma de mantener el
A
vínculo.
way to keep the link of our ministry between our ministry and the population, we had a 24-hour hotline, which it was a phone line that was answered by healthcare professionals, and they answered as many questions, as many calls as they could with questions, suggestions, tips, or anything that was requested from the Ministry of Health related to COVID-19.
También tenemos el sistema de monitoreo.
We also have our monitoring system through our social media accounts. This monitoring system gives us up-to-date information on what the population is concerned, questions, etc. And we use that for questions and answers for the website or for mass media, as well as questions and answers that we would address at our press conference with Dr. Duran, so that the population knew that we were listening to them. Next one, please. And we can talk about our lessons learned. Well, how important intersectoral work is. We, by ourselves, we could have not achieved anything. It was important to have PAHO, the different ministries involved, different organizations that assisted us because they became part of our work team. To have a single spokesperson was also important. Information was delivered in a much more clearly way. The Cuban people trust the official spokesperson that we have appointed. Only once was there a situation and we appointed a different spokesperson and everybody questioned what had happened. So that is a success story for us, and to have a single spokesperson. Also, press exchanges gave us an opportunity to build better ties with the media. All of the information that we can give them, everything and anything that is coming from the Ministry of Health is made available to the media. And the 100 radio stations that Cuba has today broadcast this conference live at the same time that it's being broadcast on TV. It is broadcast through our website. That is to say, the press for us has been a key pillar. Then the positioning of our website and social network media as a national and international benchmark. This was key because as a result of that, it made us more reliable among the media. The mass media consider it an official repository for information on Cuba. They take all the daily updates from our website itself. Also, for us, it was very important to be so consistent because it forced us to be at the Ministry of Public Health at 8 in the morning every day and to organize this press release, to be consistent, to post information when we say we're going to post it like 10 a.m. and to start a press release at 9 a.m. sharp. So it made us grow and be very consistent in the work we do and also listening to our people. Our people has to know that we listen to us. We need to keep them informed of what's going on and we need to address all of their concerns. Thank you.
Gina y Disley, vemos, ¿no? Mucho esfuerzo,
Thank
mucho
you
trabajo
very much,
en la
Dr.
escucha social que han dicho que es clave
We
para
know how important it is
las
to
necesidades
listen
y las inquietudes que tiene la
to our
población.
communities. We have to find out what their needs are, their concerns are, and thus provide a response. So this is very important. And we are receiving questions through the Q&A, also through the chat, and we will get to those questions towards the end of the program for our Q&A session. But it is interesting to see how all of this adaptation has taken place in terms of how you communicate and how people are consuming this information. Now, with that, we can move on to our next presentation. We're going to be hearing from Honduras. We'll be talking about communicating COVID-19 risks and other emergencies with community participation. And we're going to hear from Lucy Cerrato, who is a communication specialist assigned to our office in Honduras. But I do want to remind our next panelists that we are short on time, so we would ask that you keep to your 10 minutes that were allotted to you. Thank you, Sebastian, and a greeting to the colleagues in Chile and Cuba. Also, I greet the others who are sharing this space with us, and we hope to be able to share our experience with you. And we will definitely take into account some of the lessons learned, make them part of our daily communication. So we are going to begin our presentation. That has to do with communicating the risk of COVID-19 and other emergencies with the participation of the community in Honduras. Now, as a country, we have dealt with different challenges, different problems, because we have been dealing with COVID-19 and communicating that risk is a challenge. So I wanted to say that in 2019, we had to deal with a dengue emergency. There 180 people died and there were thousands of cases circulating. And unfortunately, of the 180 people who died, the majority were children. And the challenge right then was to deliver an effective message, to get the community to change behavior. And unfortunately, there was a barrier, and that was the limited human resources of the health ministry. So at the request of the Secretary of Health, we implemented a technical assistance so as to be able to approach the community, especially in those departments that had the highest number of cases. And there we had experts that came from abroad to help us with clinical management. And also, in the meantime, we were communicating information on risk. So that created an awareness in households so that parents would be more vigilant regarding their children. And here we in our office worked with the Ministry of Health closely so as to look at means so that teachers, parents, children could understand this message. We made the message short and very targeted. All of this with a view to controlling the progress of the epidemic. So there, we also looked at the support of the Ministry of Health. The idea was to bring down the curve, to level the curve off. Now, after we got through the dengue emergency, we were hit by COVID-19 in 2020. So in March of the previous year, there was a complete lockdown, and there we had another challenge. The challenge then was, once again, we were limited in terms of the human resources available so as to do effective communication. Now, also, we had serious social problems at the time. And that means, and we still face those same challenges. So there is a lack of presence in the community. Credibility is poor. And because of that, when the pandemic hit, the population did not believe that it was real. So the Ministry of Health asked for support from the Pan American Health Organization for us to provide technical assistance so that we could reach the community level and do training. Also, they wanted us to encourage community engagement as part of the process. Now, this emergency, the emergency that we were facing, was followed by Eta and Iota, two tropical storms. As you can see here, this affected the whole country. Crops were lost, infrastructure was damaged, and also health facilities were impacted. So already the population, the people were not going to health facilities. When the facilities had to close down because of damage, more than 400 health facilities in the country suffered damage. So that was another challenge. How could we get the community to engage in safety behaviors that would save their own lives and the lives of their family? So here, PAHO engaged in the following steps. So there were several actions in terms of communicating the risk during the whole process of the pandemic. We worked with the Ministry of Health, and we put together a national communication campaign on COVID-19, including actions at the community level by providing different flyers, different information pieces. Also, with the Secretary of Health, we created a whole portfolio. You will see it later on in the slides. So we had radio messages. All of this was important. Also, we delivered these flyers and they were distributed across the country. We had the opportunity of being able to provide
para que ellos tuvieran la oportunidad de trasladar mensajes
scientific information so that the people delivering the message could deliver valid information, thus fighting myths. Also, with the Secretary of Health, we published messages in different indigenous languages, in Miskito and Garifuna. That was important because it was important that we reach those communities. Also, we found volunteers from each community, and I will talk about them later on as we describe this process.
Entonces, en esta génesis
So,
de la comunicación de riesgo a partir del
in
2019,
terms of these efforts to communicate risk in 2019, then in 2020, there were different efforts of PAHO with the support of the United Nations. And that was a project preventing deaths from dengue and COVID-19 in 3 regions of Honduras that received priority. And this had to do with working with the community. There were more cases of dengue because of the way that these communities lack water. So in that way, the volunteers from the community
el éxito de este proyecto o de esta intervención en comunicación de riesgo
contributed to the success of this campaign. These are communicators, they are volunteers from each community. And what they do is they train other community members. And what was the success? What was the final result? That these communicators are able to go into the houses. There are problems with security in these communities. So sometimes the people don't want to open their door to let people in. But with the 2 projects that you see here as a response to the health emergencies caused by ETA and IOTA, we found that these volunteers were able to go house to house in these communities, delivering an effective message so that the community could make proper decisions to save themselves and their families in a language that they understood, understanding their culture, their religion, and everything that is involved in effective communication. So this is important. I worked with Lucy Cerrato in charge of health promotion, and with her, we developed this community level project. So in our monitoring, we were able to
ese recibimiento especial que le daban a los colaboradores, les abrían su puerta.
take advantage of the fact that the people were opening their doors to these communicators, letting them in. And that is important because in many communities, they said that health staff had never given them educational talks. And the main thing is that this was not delivered in technical language, but in their own language with very effective messaging, taking into account ethnicity.
Entonces acá podemos observar, ¿verdad?
Here,
La intervención que
we
se hizo.
can see
Pueden ver ustedes que
in
llegamos
some of these pictures, you can see that we reached the mosquito population. They live in a very remote area.
tuvimos que recorrer para llegar a esa zona, solo se puede llegar en avión.
You can only fly in to reach the community. To reach other communities, you have to take a 3-hour trip in the ocean, followed by a 2-hour riverboat ride. And we were able to identify in these communities, in this department called Gracias de Dios in Honduras, it's the mosquito community. We were able to reach this area. We were able to train our human resources to tell them how important it was to communicate the risk. We said that it was important that they come up with partners to help them multiply the message so as to impact the community. There was a great result because these collaborators were included in the rapid response teaching the community to deal with COVID-19. And these volunteers did house-to-house visits. Also, as I said, we worked with different ethnic communities that live in remote areas. And the important thing that we want to underscore is the translation of these educational tools into Mezquito and Garifuna, which is not easy. But these volunteers were able to educate their community using the materials that have been translated into the community's language. You have 2 minutes left. Thank you. Also, the impact was so great that we engaged 500 volunteers and we reached 60,000 families. So that is a big number. We had the opportunity of going house to house. We consider that very important. So also in risk communication, we were able to reach different sectors, and in this way, the message was incorporated into these community health groups, and that helped promote this message. These are the educational materials that I was mentioning. Those that are at the top on the right are in Mezquito. And also we have other materials in the portfolio that are in Garifuna. And all of this has been validated by the community and by the Secretariat of Health. So all of that is very important in terms of delivering the message. Now, as lessons learned, this is a good response on the part of the community to the materials that have been translated, and it's helped us approach them. Also, there has been a partnership increasing the impact. We donated megaphones. That is important to reach the community. And in this way, the volunteers were able to carry out their work. One of the things that we would like to highlight is that it's important to identify people from the community itself so they can train their neighbors. Now, we're going to watch a video, and I'm going to ask my colleagues to please show us the video so that you can hear from the community itself, so you can see how they benefited from this communication of risk. So we're talking not only about COVID-19, but other risks, and this in a country that faces some major challenges. So one important thing is that the Secretariat of Health support this effort. All of that is important to get the prevention messages to the community. We were visited to talk to us about the health, and I appreciate the time that they devoted to us. They gave us some really important information, and if we put that information into practice, we will be protected against many diseases, not only against COVID, but malaria, dengue too, and other things that affect us.
Muchas gracias, Karina.
Thank you, Karina. I think that we reached the end of your presentation. Thank you for the video. Thank you very much. And we saw that in the case of Honduras, the pandemic came hand in hand with other problems like dengue. Dengue was following its course, and there were other situations too that made it hard for people to follow the recommendations. But it is interesting to see how with this project you involve the community so that they can respond, and how you reached people that perhaps cannot be reached from the central level. Thank you, Sebastian. This was a challenge because we had the pandemic. Now we have the vaccination effort that continues to evolve, but we continue with our campaigns to communicate risk. And all of this is important. So I want to thank all of you for this invitation.
liderado por Lourdes Ramírez, Daisy
And
Núñez,
it is
Cerrato, mi persona,
important to mention Lucy Cerrato, the other members of the communication team. Without their support, we would not have been able to reach the field. So I also thank those of you at headquarters that provide us with the support we require. Thank you, Karina. Okay, we still have two more presentations ahead of us. We have more than 280 people that are still connected. And in the Q&A, we have several questions for the Q&A session. So please continue to submit your questions. We will definitely get to them. I would ask the next panelists to try to stay within the 10-minute limit so that we will have time for the questions. Now, we're going to hear from Cuba again. This is called Communication and Psychosocial Support to Cuban Health Staff during COVID-19. We will hear from Dr. Lidia de la Caridad Hernandez Gomez, who is professor of the National Public Health School and a member of the social support effort in Cuba. Thank you. I wanted to thank you and all of the colleagues with us today. Once again, I wanted to congratulate you and thank you for this opportunity to exchange experience with others. The next slide, please. Here is what we're going to be discussing. We'll basically be talking about planning and coordinating actions and also the psychosocial efforts for healthcare workers. The next slide, please. I've already heard from some colleagues, the colleagues from the Ministry of Health, but also people working in other contexts. But we would emphasize that in emergencies, the Ministry of Health here in Cuba assumed coordination of all actions to deal with the crisis caused by the COVID-19 pandemic. And we coordinated the action of experts in social sciences. As you can see, the University of Havana with the School of Psychology, Social Communication, Neuroscience, and also the Council of Social Sciences from the Ministry of Science and Technology, the Ministry of Education, who was a very important partner, also international organizations. And here I would like to emphasize the support that we received from the Pan American Health Organization, the World Health Organization, UNICEF, and other international organizations. And also we had good community participation. That was an important ally in taking these actions. In late 2019, and this was already mentioned, in late 2019 with COVID-19, Cuba organized in January 2020 a care protocol. It was a comprehensive protocol, and there the mental health component was always present. That is something that sets our protocol apart. We are now in version 1.6, but the mental health component was always part of it. As you can see, one of the groups that we're focusing on is healthcare workers, not only those that were in Cuba, but also the brigades assigned abroad. When we talk about healthcare staff, I'm talking not only about those in the red zones, and of course there, the characteristics of the services being provided were involving different elements, but we were all following the same protocol, regardless of where we were assigned. Something that was already mentioned is we worked with medical students, nursing students. They too joined these efforts. I wanted to emphasize that one of the important aspects that characterized our actions was related to research. In other words, not only did we begin to take action, but also we continue to work with a group of experts that are doing research, and that gave us important information so that we could get guidance for our actions, and also this allowed decision makers to make informed decisions. And also the actions that were developed in terms of communication and using different methods. For example, I talked about the protocol and the communication protocol regarding mental health, the video conferences that were held to exchange views and to provide information to each territory, because by having a single system, we were able to have organizations from mental health groups in each of the areas of the country that facilitated our action so as to provide general guidance for action, but always taking into account each context peculiarities. I am talking about the different territories, the different areas of the country, and that is something that was taken into account. The exchange, a systematic exchange with international organizations. That is something I mentioned early on, and that was part of our efforts. This helped us coordinate action and support. Also, we have used TV conferences, TV spots. We're talking about healthcare workers. They need to receive information from reliable, timely sources. This provided not only information, but also support to this important sector. Now, in other times, we have had emergency situations, and Cuba has a great deal of experience in this regard. For example, we have dealt with other crises, other emergencies, and usually those emergencies are because of weather phenomena or dealing with dengue, for example. But this was a major challenge. It had no precedent in terms of our healthcare workers. So they had to be kept informed. We had to communicate the risk because of the need to adapt and because they needed to take protective action. Not only did they have to care for others, they had to take care of themselves using the resources that might have been hot or uncomfortable, but in addition to taking different actions, they had to take those actions to protect their own health. Another important thing for us, and this is mentioned already, is the coordination. We had to partner with different types of media, especially with television. Social media was also important. In February of 2020, it was pointed out that one of the most important actions that could be taken by governments was protecting their healthcare workers. So social media also was an important action to reinforce actions taken by our healthcare workers. This was a very important element. Also, a code was prepared having to do with lifestyle and how to live in the new normal. That was in late 2020 when we thought things would improve. But this was for the general population. So a life code, a living code was generated not only for the general population, but also for healthcare workers. Another action had to do with the partnerships with, for example, the Ministry of Education. They have an organization to produce audiovisual materials. So materials were developed for health workers. There were teams that were assigned for 21 days, and then they had to go into quarantine. So support materials were created taking into account the need for social support, mental health, to help them protect their mental health, and also containing recommendations for these people that were assigned for a long time. They were under a lot of stress, and also they had to be isolated. They had to work far from their families. Also, we created psychological support manuals, and this in the APK format. And also there were specialized journal articles. This was done with the support of the Pan American Health Organization and also the Center for Promotion of Mental Health. That is a space that created materials for our workers. And now, turning to the areas where interventions were implemented, in this case, from a personal and organizational standpoint, I need to mention the training that was given to our workers, especially to provide resources to deal with these intense stressors that were faced, that continued to be faced because of the pandemic. That stress has continued. So there was focus on self-care, and I also mentioned the life tips. And then organizationally, and I wanted to refer basically to communication, but our workers told us that communication was a valuable and necessary resource to better perform their work with a system of social support. And this support needed to come from peers and from the community. So the information on the pandemic coming from the media was perceived as being quite adequate. And that created feedback and helped guide our action. We felt that it was very important to integrate actions from other sectors of society, everything having to do with social support and recognition. As I said before, that became positive reinforcement for this specific group, which is made up of the healthcare workers.
So we can mention as a summary in terms of lessons learned, first of all, that social communication, in this case, risk communication, must be an essential component as part of the mental health actions that were included to the national protocol to fight COVID-19. Also, that investigation or research is an important resource to for communication purposes, and also multidisciplinary actions, including colleagues from other sections that mentioned this as well, is key. It's key to have multi-sectoral representation in all of these communication actions. And another important thing is to have specialized and trained human resources to communicate risk and during emergencies and disasters, and also have a level of literacy in the population that enables them to understand the message and replicate it to the rest of the community so that they can be repeaters in unprecedented situations such as COVID-19. This concludes my presentation. Thank you very much. Thank you, Dr. Lydia. Very interesting. And we saw that everyone's mental health was impacted by the pandemic, but especially for healthcare workers who were the first line of response. And it's very important to highlight how important it is to incorporate research and investigation, because having data and doing research enables us to strengthen the message. And I also very much like the message that you gave, that is to say that communication has to be a way to support our communities. I thought that was very nice. So thank you very much for your presentation. And without further ado, we're going to move on to the last presentation during this virtual seminar on lessons learned in risk communication. Thank you to all of you that joined us and that continue to join us. And now we're going to hear from Chile. And it says, we're going to talk about the importance of having risk communication during campaigns to prevent and promote COVID-19 in open sky fairs in Chile. We're going to hear from Juan Salvo Palmas, communications specialist in Bajo, Chile. Chile, go ahead. I'd like to send greetings to all the countries that are joining us from the Americas. I'm here from the Quillota jail. I would like to tell you that we started giving HIV workshops to women trans population deprived of liberty. I'm in a car, so my sound might not be great, and we might lose communication. But this is a campaign, communication campaign that we put together in collaboration with the academia, the Association of Market Workers, UN, and the PAHO and WHO office in Chile. The purpose was to develop a social communication campaign to prevent COVID in markets or open markets or fairs in a participatory way following risk communication principles. Now, how this initiative came about? Well, as a result of a monitor training that was developed between the academia, UN agencies, and the Association of Market Workers in Chile, we developed the train for trainer courses. And as a result of that, they said that they needed to have some sort of communication campaign that on the one hand, it could target our audience, and on the other hand, the people that go to the markets to purchase produce all over the country. Next one, please. Here we can see one of the slides that focuses on vaccination as well. And I can tell you a little bit more about these campaigns in my country. These workshops followed the manual in our Ministry of Health. It's a manual on best practices on open markets faced as a result of the microbiology hazards in COVID-19 pandemic. So market workers followed our manuals from the Ministry of Health. Next one, please. So once we developed those train the trainers workshops, we had held an online focus group aimed at knowing firsthand from the workers and the owners of the market spots all over the country what had worked and what had not worked as a result of their trainings. That is to say, what their perception was after attending training. And out of all the things that they had learned, what guidelines were followed at the markets and what guidelines were not followed and therefore needed more work. Here we can see the focus groups outcomes. As far as strengths, workers were aware of how to protect themselves to prevent COVID-19 transmission. Use of masks and social distancing was something that they did every day that they went to their market stands. And the majority of them during their work schedule would listen to the radio and check the social media on any kind of updates and also any COVID-19 relevant information. And the same went for the customers. Everyone attending the different markets knew that we were up to date through social media. So as a result of that, we were able to identify certain weaknesses or things that could not be practical to implement at the market. Here we can see what did not work at the market and that were not very common among the workers. For example, hand sanitizer dispensers were very useful, but it was important to keep those hand sanitizer containers or dispensers full. And all the flyers contained very important information, but they had to have compact text and have an easy to follow layout. And the different signs entering the one-way route was very useful, but sometimes it was very hard to have access control at a single point. But in the smaller markets, it helped, but in the larger market, it was a little bit more chaotic and harder to control.
Acá viene lo siguiente que lo que
So those were strengths. And now let's talk about what definitely did not work.
que son muy difíciles de trasladar por su peso y la estructura.
These signs, the large signs were very hard to move around, and mobile hand washing stations were very hard to move around because the tanks held over 500 liters, so that was not a way to help prevent COVID transmission in the market. And also, these flyers that had a lot of information were thrown away on the street, and that contributed to pollution and did not help. Now, in terms of the key, what we saw as a result of conversations that we had with market workers all over the country was that the problem were the customers, those that visit the market on a regular basis. They were the ones that did not want to implement those prevention measures coming from the health authority. One of the things that we saw was that everybody went in crowds. So like the entire family would go to the market, senior citizens, that is to say, grandmas, pregnant women, young children, especially over the weekend where the markets are a common place to purchase produce and flowers. And unfortunately, like the entire families will attend. And based on that, we developed our strategy. Next one, please.
La siguiente es
Next one.
el concepto vertebral de la campaña.
The backbone of our campaign was stemmed from the work from these virtual focus groups with market workers.
Quisimos ocupar frases populares.
First, we wanted to use some popular phrases linked to the items that are sold at the markets, basically around fruits and vegetables, like eggs, fish, vegetables, and to also carry a health-related message to strengthen COVID prevention measures and messages. So we, in Chile, being healthy, you use the phrase to be cool, instead of cool as a cucumber, cool as a lettuce, but it refers to being healthy. Now, as part of a strategy objectives, well, to strengthen prevention and self-care messages in order to prevent COVID-19 in markets and public spaces through a change of behavior. Another very important and interesting thing was for market workers to be able to keep working in a safe and ongoing manner, because these markets are key to distribute fresh produce. The target audience were the market clients as well as market workers. And according to the survey that we have of produce markets in Chile, according to a survey from 2016, over 340,000 people work in these markets, and out of which 113,000 are owners, and they have a market stand from the north all the way down to the southernmost point in the country. Here we can see a picture of how the produce market works. In terms of the language, the healthy message campaign that best focuses on the lettuce used the different types of produce being sold at the market, and with a simple and easy to remember phrase in the Chilean population, we try to craft the message around, like I said, popular messages, things that you hear from a very young age. They strengthen COVID-related prevention actions. Next one, please.
Con un lenguaje, transversal a todos los sectores.
So this would be a language accessible to all levels of the population. Regardless of their economic level, these are messages that are used and understood by the entire population. It's also important to mention that maybe adolescents and young people may not use them. They might hear about them by their older siblings, parents, or grandparents, but they do not necessarily use them. But since they're not the ones that regularly go to the produce markets, and they're not the ones that buy, they were not part of the target audience. Next one.
Y acá viene a continuación,
So
¿cuáles son estos mensajes, las ideas?
here are some of the ideas and messages we use. Healthy as a lettuce means to be good. If you want to look like a tuna, get the vaccine. It rhymes in Spanish. Let us not pile up like ears of corn. So don't go stacked up or piled up. We need, it's easy to, it's a piece of pie, in this case of papaya rather than pie, to prevent COVID. And these are some of the other ideas that we used. No, do not minimize the recommendations to prevent COVID transmission. This phrase centers around the egg, and being a fish head means that they are not a small thing, that it shouldn't be minimized or discarded like a fish head. And so we take advantage of all these, items that we included in our posters. Now, in terms of the different stages, there were two. The first one that took place during our summer months, which are January and February here, and where there are a lot of produce available in the market, we resorted to the social media of all the organizations that were part of this campaign. And also, we broadcast radio messages throughout the territory, from the northernmost point, border with Peru, all the way down to the southernmost point, through the Fucoa radio network. We also held a campaign on social media that included posts with all these different posters that I have talked about. And also it was also important to convey the message verbally between the different markets. And they asked us to mention them because they would be joining today. So they played a key role. Now, to conclude, the second stage of our communication focused on podcasts or radio spots. And currently, those are being broadcast through different communications channels and the different agencies that are part of this campaign. And we also had a more specialized produce, which are WhatsApp stickers. So in each one of the WhatsApp chats, it said, okay, if you're going to go to the produce market, they could send any one of these stickers with the different fruits or vegetables or fish. It wasn't widely used because it was a little bit hard to manage stickers, and our target population was not very familiar with how to use it. Do we have more time to show? No? Okay, never mind. Anyway, so that's one of the things that we did with our health services with Dr. Mario Cruz, and he's talking about the recommendations to go to the produce market in a safe and healthy way. One more, and with that, I will finish. Let me talk about the next steps.
Claro. Y los resultados de la campaña.
So as far as outcomes, well, it was widely accepted. We saw an increase in I like, retweet, or share, and positive comments in all of our social media accounts. We also had national impact in all 16 regions of our country, and our country is over 4,000 kilometers from north to south, and we reached potentially 340,000 people between owners and workers, and we reached over 90% of the population that goes to those produce markets. So there's a huge potential to strengthen our communication measures to prevent COVID. This concludes my presentation, Sebastian. I'm sorry, let me share our lessons learned, which is my last and final slide. You can see the reactions in our social media accounts. And my final slide.
Las lecciones aprendidas, y con esto termino.
Let me conclude with my lessons learned. Use of mobile technology has become a good tool to reach communication, but there's still gaps in accessing the phone, and sometimes there's issues with connectivities in the areas that are a little bit farther away from urban centers. Also, to use phrases that also make sense among the migrant population. Chile has had a lot of migrants over the past 5 or 10 years, so maybe having very Chile-specific phrases may leave some of the Colombians or Venezuelans out. And also, it's important to be able to have physical signs at the market. We have not been able to do that because of the pandemic. The majority of the companies that make these banners are closed. So, but then in one of the later stages, we may be able to order some of these banners to have them support our campaign. Thank you. Thank you so much, Gonzalo. Very interesting campaign. After doing research and holding a virtual focus groups, you used the language that focuses on the produce market items. They are very catchy and very funny, which is what we try to do in public health. This was very interesting, so congratulations on this. And now, without further ado, let's go to the Q&A session. And for that, I'm going to give the floor to Paulo Lira, Communication Advisor at PAHO. Paulo, go ahead, and thank you so much for joining us. Thank you so much, Sebastian. I would like to congratulate every one of the speakers for your excellent presentations. And I would also like to congratulate Sebastian on your work and on your birthday today. So happy birthday to you. Okay, well, we have a lot of questions here. And as usual, every time we talk about communication strategies, a lot of them focus on assessment or evaluation and impact. So I'm going to read the first question that has to do with the health brigades in Chile, and then some others that apply to all of them. The question is, as far as this health brigade strategy in Chile, have you assessed its impact? Because some studies show that the population would trust the healthcare professional more. And I would also say, and this is my own, that there are other studies that say that people are more prone to change their behavior whenever they can talk about this behavior with someone. So taking this theoretical framework into account, how did you assess the impact of this health brigade strategy in Chile? Go ahead,
Hola,
please.
Paulo. Bueno, las
Hello,
cuadrillas sanitarias
Paulo.
tienen
Okay,
distintos
well, the health
programas, ¿ya?
brigades
En la
focus on
estrategia
different
general
programs.
de lo que son
We have the
los cuadrilleros
overall
sanitarios, que son
strategy
estos
of the health brigade
390
members,
cuadrilleros que
which
están
are
en todas las regiones.
390
A ellos se
members
les
in all
hace
regions,
periódicamente
and they
capacitaciones y se les
receive
hacen encuestas también
ongoing
para ver
training
cuál ha
and
sido el
surveys
impacto de
to
ellos
see what their impact
en sus
has
conversaciones con las
been
personas.
in their
Lo que
discussion
nosotros hemos
with
podido percibir,
people.
por
What
ejemplo,
we have been able
es
to
en varias
receive, for
situaciones, por
example,
ejemplo,
is
en
on
las
several
filas
situations.
que
For
se hacen
example,
en
whenever
las
people
salidas
stand in line
de los comercios, porque por el
outside of a
tema de los
store
aforos,
because of
cómo
the
la
maximum
gente poco a
capacity
poco va
limitations,
tomando distanciamiento y
people
también se va
little by little
educando a las
start
personas que
spreading
tienen
out
que
and
regular
they
esas filas.
educate the people that are standing
También
in lines as
cada
well.
región va
Also,
viendo
each region
según sus estrategias,
can see
porque
based on
Chile
their
es muy
strategies, because
amplio y
Chile
largo y
is
por lo
a very
tanto
long country,
la
and
forma de llegar
therefore
a las
the way
personas
to reach
es diferente
people
en el sistema
varies.
rural,
And you
o sea,
have
en
the
ambientes
rural
rurales, en
sector,
ambientes urbanos
semi-rural,
y también
urban,
por
and
ejemplo, si es una zona
it
con pueblos
also
originarios. lo que
also
nosotros
have
hemos
like
visto también,
indigenous peoples
por ejemplo,
areas.
un caso muy
So
particular
what we
de
have
una
seen
zona rural aquí en
in one of the
Chile
rural
es que
areas here in
con
Chile
un muy buen
is
porcentaje de
that
cobertura de
with a
vacunación, que es la región de Ñuble,
with a
había un
very
lugar
good
donde no
vaccination rate,
tenían, la
there
gente no
was
se estaba vacunando por
an area where
desinformación y
people
sobre
were
todo por
not
el
getting
acceso a
vaccinated
redes
because of lack of
sociales,
information
los que decían
and
el
because
mito. Hace unas semanas atrás
they
apareció
access
aquí una persona que
social
decía que
media
se
saying
imantaba si
that
se ponía una cuchara, si se vacunaban.
if
Entonces
you get
la labor de las cuadrillas
vaccinated, you
sanitarias
will be
fue ir al lugar
magnetized and a
a
spoon
8
would stick to
manzanas a
your
la
arm.
redonda,
So
donde estaban a
anyways,
2 cuadras
we
apenas de donde se podían vacunar,
some people were
y
only 2 city
lograron
blocks away
que
from the vaccination
140
site, and
personas,
out of
alrededor de
140
140 personas
people
se vacunaran. Y eso es en una
were
conversación de uno a
ultimately
uno. Y también
vaccinated,
era una
and that
zona de alta
was the result
incidencia
of
de
a
casos.
one-to-one
Entonces
campaign, conversation
las
campaign.
regiones van viendo el impacto
So
que van
the
creando
regions
y
can see
también
the
van
impact that they
relaborando.
are
Las
creating,
cuadrillas
and
sanitarias
they
escolares que partieron
recalculate.
en
We also
marzo,
had health
también se les
brigades
hace
in
encuesta a las
schools.
personas
They
que son parte de
also,
la
what they
comunidad
do
y ellos
is they
mismos también van
survey the
diciendo
people
qué
that are
son
part
los
of the
mensajes
community,
que
and
necesitan. Por
they
ejemplo,
tell
ahora
them
nosotros aquí
what
estamos en
messages
invierno
will
y la
resonate more
preocupación de
with
los
them. So for
padres
example, now we are
cuando no
in
están en
winter,
cuarentena es
and
mandar a los niños
the
al
concern
colegio,
parents
y
have
lo
is
que los
when
mismos cuadrilleros
lockdown measures
de
are
la
not in
comunidad
place,
escolar
whether
nos
or not they
decían
should
es que
send their
finalmente
children to school.
los brotes
And
no
so
se
what
hacen en
the
los
health
colegios, sino
brigade
que
members saying
se
that
hacen en las
outbreaks do
casas con las
not take
reuniones
place
sociales. Entonces tuvimos que
in
trabajar
school, but rather at home as
fuertemente
a
el
result of
tema de
social
que nos
gatherings. So
tenemos que
we had to
cuidar,
work
como cuidamos
very
a los niños
hard
en el colegio,
on saying, well,
cuidamos a
just
los
as we take
niños
care of
en
our
la casa,
children in school, we
¿ya?
have to take care of our
Entonces
children at
todas esas
home.
cosas más
So
cualitativas se
all of
van
those more
observando
qualitative type of messages can be
con el trabajo que van haciendo
drafted or
cada
crafted as a
cuadrilla
result of the
sanitaria
work
en
that
cada
each
región.
health brigade
Y
does
también
in each region.
las cuadrillas sanitarias ayudan mucho
Health
en las cuadrillas
brigades
sanitarias en tu
also
barrio.
help
Las personas también nos van diciendo qué material
visit
van
the neighborhood.
necesitando
People
según
tell us what
su
type of
barrio
material they
y
need
según los
based on
mitos que hay
the
alrededor.
neighborhood they live in and
Y
the myths
en lo que
that
tiene que ver
circulate
con
in it.
el acercamiento a las
Then
personas de salud, muchos
also, as far as
cuadrilleros
healthcare
tienen
workers, a lot of the healthcare
profesiones o
brigade
son
members
estudiantes del área de la
are,
educación y
for
de la
example,
salud por esto mismo,
study
porque les genera mayor acercamiento y
are at
mayor
medical
confianza a
schools or
las
education
personas
schools
y tienen también datos concretos con los
students,
que pueden también
because
derribar
that brings them
mitos y
closer to the
temores de la
people and they
ciudadanía.
have specific tools to um, dispel questions and myths. Thank you so much, Noelia. Okay, I wanted to ask a similar question to the other panelists. Luis Zagarra and Jorge Moreno and other colleagues are asking whether you have seen a reduction in transmission rates, or what kind of impact have you seen as a result of these communication campaigns? These measurements include, of course, both successful outputs as well as the actual impact of these initiatives. In the case of Honduras, there's also a more specific question that says 422 people were able to train 150,000 people in Honduras. How was that estimated? How did you reach these figures? So Sebastian, if you agree, I believe that we could go around the panelists. Maybe we can begin with Honduras and then move on to our colleagues from Cuba and Chile. Of course, go ahead. Thank you, Paulo and Sebastian. Okay, the question that was asked to us had to do with how we were able to measure the impact in our community. Well, each one of the voluntary collaborators submitted a report to the coordinators that were hired for each one of the departments in Honduras. So when they developed or they put together those reports, which were a tool that was reported for this purpose, they would consolidate the information and then they would extract all of the information and have a breakdown of the population that was reached. And we were able to make a lot of progress because they worked over 5 months. So they worked Monday through Fridays. And what's successful is that these young people decided to volunteer even more of their time. So they worked Saturdays and Sundays in order to reach more people in the community. Thank you. Thank you, Karina. I don't know if our panelists from Cuba and Chile would like to add to how you measure the impact of the interventions implemented. Yes, in Cuba, we can share how we measure the assessment both in social media as well as how impacted transmission rates. In Telegram, Facebook, and Twitter, through the statistics features that the platforms provide, we were able to do a monthly assessment, and that assessment was broadcast via video conference in all of our regional offices. And in the case of the press release, the Cuban TV gave us rating reports on the press conference, and this was the second that had most viewers after our national TV news station. As far as how it impacted transmission rates, well, we had an experience could share. Back in November or December of last year, we were trying to go back to normal. And little by little, like Dr. Lydia said in her presentation, we thought that we were getting better in terms of figures, but then unfortunately we saw a rebound in transmissions. And so when we decided to hold a press conference on a weekly basis, the population was requested more frequency. And when we went back to daily conference, people became more aware of how important it was to take care of themselves. And the fact that people kept their masks on during the press conference also reinforced the message of how important it was to do that. Also, whenever we had our Ministry of Public Health rather than the spokesperson, the population was even more aware. They were showing, for example, how to measure the importance of our press release.
I don't know if anyone else wants to answer, but we can see that there are different ways of measuring the impact of these different interventions. So please go ahead. Now, in the case of our produce markets, these campaigns were not costly. It's something where we used a designer from FAO, also with our social media. We measured the number of followers. To measure the success of the campaign, but a lot of the campaign was carried out over the social media. I'm sorry, his sound is breaking up. Thank you. I think that the challenge is we have to try to keep the cost of these campaigns down, but we always have to be able to answer those questions, because at the end of any communication seminar, that is the question that always comes up. How can we evaluate? How can we measure impact? And that is the purpose of these campaigns, right? Now, I don't know if my other colleagues from Cuba would like to add something, or should we move on to the next question? Let's go to the next question. Great. Okay, here we have a question also from Jorge Moreno. And I think that all the panelists who want to answer should. And that is, what are we thinking about pandemic fatigue? So after more than a year, people are tired, they're fed up. And in addition, we have fake news that continues to have an impact. So what would you say about this? And what is the impact on your communication strategies? And do you have any strategies to offset the fatigue and the impact of fake news, especially fatigue, I would say? What are you doing in countries like Chile and Cuba? I don't know who would like to answer.
Puedo responder yo si quieres,
I
Paulo,
could
por
answer.
parte de Chile.
I could answer on behalf
Em,
of Chile.
Bueno, en cuanto a fake
Well,
news,
in
un
terms of
trabajo
fake
importante,
news,
uno de los lineamientos importantes que tienen las cuadrillas sanitarias,
something
nosotros
that
además
has
de las
been done by
cuadrillas
the Health
sanitarias tenemos
Brigades is that in addition
algo
to the Health
similar
Brigades,
a
we
lo
have
que
something
hace
similar
Cuba.
to what
Tenemos
Cuba
3
is
puntos de
doing.
prensa a nivel
We have press conferences
semanalmente,
that are held every week.
en donde también la
And
subsecretaria Daza está a cargo
there,
de dar mensajes que se trabajan en torno a la comunicación de riesgo con
Deputy
datos y
Secretary's
evidencia,
office
desde
provides
embarazadas que se están contagiando,
risk
el tema de
messages.
los rezagados en
They
el
look
proceso
at
de
the number of
vacunación, que esta
pregnant
semana llegamos
women
al
that have
80% de la
had
población mayor
the
de 18 años
disease. Also,
vacunada,
they look at the effect
seguir con
of
el
the
tema de los
population over
temores, etcétera,
18 that have received
tocándolos en el punto de prensa, y
vaccines.
además también se
So
van
all of that is
dando
covered in the press
informaciones
conference.
en la página del
Plus,
Ministerio
there
de
is
Salud,
information
informes
provided by the Ministry of
epidemiológicos,
Health,
y todos los días también se
epidemiological
suben,
data,
los días que no son puntos
and
de prensa, las
every
cifras a nivel
day
nacional.
that is
Por ese
posted
lado,
in the
manejamos el tema
press.
de
So
los
also in
datos
that
que están
way, we
accesibles a
deal
todos,
with
tanto
the
para la
data.
prensa como para la
Data is
ciudadanía.
available to
En
everyone,
cuanto a
to
las
the
cuadrillas
press,
sanitarias,
to our
estas cosas más de
citizens.
mitos, se
Now,
trabaja mucho también con las radios
also in
locales. Esto lo
terms
vemos más
of
que nada en el tema
the
de
health
zonas de mayor
brigades, that we
ruralidad,
work with
y
local
se trabaja
radio
con las
stations,
radios
and we
locales,
work
y los mismos cuadrilleros también van haciendo mensajes y difusiones a través
with
de las redes sociales.
messages
Y todos los
through the
mensajes que
social
nosotros
media.
damos, que la
So
subsecretaría
what
da, se
we
trabaja
do
con
is
gráficas,
the
algunas son
Secretariat
impresas y otras
works
son a
with
nivel
graphs.
gráfico, porque lo que vimos para poder
Some of the
compartir por
graphs are
WhatsApp, lo que
supported
vimos
by
nosotros sobre
corporations,
todo,
but also
que
we
les
have
sirve
found
mucho a las
WhatsApp to
cuadrillas
be
sanitarias
effective.
en tu barrio,
This
que son
is
estos líderes
important for
comunitarios, es el
the
WhatsApp. Todos tienen
neighborhood
WhatsApp y se
health
van
brigades.
compartiendo,
Everyone
tanto videos
has
muy
a
cortitos
WhatsApp
como lo otro.
account,
Y en
and
cuanto
they
a la
share
fatiga
messages in
pandémica,
that way.
lo que se está
Now,
haciendo es
regarding
reforzar unos
pandemic
programas que
fatigue,
tiene
what we're
el
doing is we're
Ministerio de Salud,
reinforcing some
que es
campaigns of the
Saludablemente, una
Ministry of
plataforma
Health.
donde las personas también pueden
It is
acceder
called
a
Healthy, and that's a
asistencia
platform
psicológica
where people can find
para el manejo
psychological
de la pandemia,
support
para el
in
manejo de
dealing with
las
the
crisis que
pandemic
tienen las personas durante la
and the
pandemia. El 60%
crises
de las
being
llamadas son por temas
suffered
de
by people
ansiedad.
during the
Y
pandemic.
eso es
These are
totalmente
basically
gratuito, incluso
anxiety
personas que necesiten más asistencia pueden
spells,
agendar
and
4 sesiones gratuitas
in this way, people can get
con un mismo
4
psicólogo durante un mes.
sessions
Entonces se
with a
está promoviendo
psychologist
mucho
during
el tema
1
de
month, 4
saludablemente,
different
y en
sessions
esa
at
misma
no cost.
plataforma también,
So
que los
that is
cuadrilleros también
something
lo dan a
being
conocer, también las
promoted
autoridades.
using that
Hay
platform.
distintas informaciones según la persona y el ciclo de vida en el que se
Information
encuentre.
is being
Y a
posted
eso también le
that
agregamos
is appropriate
el
to
programa de Elige Vivir
different
Sano del gobierno,
points
en
in the
donde
life
hay
cycle.
un
And
periodo
we're
de
also
tiempo, a pesar de
working
que
with
esté
the
en
rest of the
cuarentena,
government, where
diariamente,
there
todos los
is
días,
a
de lunes a
period of
viernes, en un
time
horario, y sábado y domingo otro, para promover la actividad física,
where
que
physical
está
activity
vinculado también
is
con el tema de la
promoted.
salud. Y
And
eso
that
mismo también lo
ties
damos a
into
conocer por los
health
distintos
too.
canales.
And that is something that we disseminate using different channels. Thank you. Very good work. It is getting a bit late, and I'm wondering if any panelists would like to add to the answer to this question. Yes, in the case of Cuba and fake news, what we have done is we continue with listening to the community so we can figure out what doubts they have. And in that way, the fake news circulated, we convert into questions and answers shared with the population. And that is included in our daily press conferences. Those are covered by our official spokesman. Also, this is put on the website, and also information is provided to the national media. That would be the press, that would be radio programs. And in the case of vaccination, we have had good communication. In that way, we have well-informed messages getting out, and that offsets the effect of fake news and addresses the concerns of the population. In the case of pandemic fatigue, Cuba has a line called Punto Tres, and there we have the support of specialists that provide care for the population. WhatsApp groups have been created for psychological support, and also the psychological branches of our healthcare system have worked nonstop. Thank you. Well, friends, I think this brings us to the end of the session. Sebastian, I would ask you for some closing remarks. And once again, congratulations on your birthday. Thank you, Pablo. Thanks to all of the panelists from Chile, from Cuba and Honduras. So first, I wanted to call on Maritza Largaña, who is our consultant. And first of all, I want to thank all of the countries who took part in this event. I was very pleasantly surprised to hear about all of the actions. Now, I did want to have some comments, but without referring to specific presentations. But first of all, we see that this is a health concern that can be approached from different ways, looking at mental health and other dimensions. That is something that is very respectable. All presentations have a cross-cutting element, which is listening to the concern of our community participation. All of that is important in terms of risk communication. Now, we have to see how we can approach our citizens, how we can keep an open and transparent dialogue. Then a third element that I noticed is that we have new possibilities. We have to include new elements in our risk communication. And these elements have to do with technological advances. I wanted to congratulate Cuba for their Telegram approach, how they established that. And that is something that other countries may be interested in. Other countries are using technology, but on a more informal basis. Also, I congratulate you on the campaign and the Health Brigades, showing that there are agents that address each community, taking into account their own needs and culture. Also, it is very important to hear the messages that are evidence-based. Work has been done on different elements to deliver official information, and that information has to be in keeping with the messages that have been shared with the community. And then lastly, and this is something that I think is wonderful, we always have to think that in an emergency, it may well be followed or go hand in hand with other emergencies. That was the case in Honduras, where a lot of work has been done. It's been challenging, and they have had one emergency after another. They're dealing not only with the pandemic, so there can be other crises that occur at the same time. And that is something that we have to take into account in communicating risk. And then in concluding, it's very important that communication be part of our managerial process, and it has to serve different purposes. There has to be social support, and that too helps mental health. So I thank you. It's important that we continue to develop our risk communication, that we continue to listen to our communities, and that we take into account the need to engage the community. Thank you. Thank you, Maritza. I wanted to thank all of you, thank our panelists. Thanks to all of you for joining us and for following this session. Thank you for your questions. And later on, we will be sharing a recording of the seminar as well as the presentations. You will receive an email from us with these materials. Please stay in touch. We will have other events to share more experiences from the region with you, and we hope to continue to learn from you and strengthen our risk communication. Also, we want to work with other sectors. This is something that is of great interest to many different sectors. All of this is important in finding response to the pandemic. So once again, I thank you all and do take care.